Are you a man who may be suffering with erectile problems, erectile dysfunction, or painful erections? Maybe you're somebody that's recently had prostate surgery or have diabetes and have had difficulty getting erections following this. If you are, you may be very interested in a new revolutionary treatment called the P-shot or Priapus shot. This is taking over the treatment for erectile dysfunction problems as a natural biostimulatory regenerative process to restore normal function. And it even may give you an increase in size of your penis. The P-shot or Priapus shot was developed by Charles Runnels in the USA, who also developed the O-shot for female sexual dysfunction. The P-shot involves using the platelet cells and the growth factors and harnessing the natural regenerative ability of our body to repair and restore. This is using a treatment called PRP or platelet-rich plasma. We take the blood from a small amount of blood from you and extract the platelet cells and the growth factors and literally inject those platelet growth factors back into the penis to regenerate penile tissue, restore the blood supply and improve the nerve and sensation to the penis. The patients that benefit or would benefit from the P-shot procedure are any men that are suffering with erectile dysfunction for physical reasons. Erectile dysfunction is very common. It increases with age, and certainly by the age of 50 it has been shown that perhaps 1 in 4 men are suffering with some form of erectile dysfunction. It's much more common with other physical illnesses and diseases such as diabetes or cardiovascular disease, whereby the neurovascular or blood supply to the penis is impaired. Often medications and drugs used to treat these conditions, such as high blood pressure tablets, can also make the situation worse. Following prostate surgery, it is very common and almost universal that men will suffer some form of erectile dysfunction, which can be often very severe. Erectile dysfunction is commonly treated with medical drugs such as Viagra, etc. And in a lot of cases they can be very helpful by improving the blood supply to the penis. But often Viagra doesn't work on its own. In this situation, the P-shot can be used alongside other medical treatments or can be used as an alternative. Many people find that following the P-shot they no longer need to use medical treatments such as Viagra. There is another condition that men report which is less common but often quite disabling and distressing, and that's a condition called Peyronie's disease. Peyronie's disease is an inflammatory condition of the tissue of the penis, whereby initially erections become very, very painful and difficult to achieve through the pain. But following this there is scarring within the shaft of the penis, which will reduce the ability to the penis to become erect and often cause bending or significant distortion of the penis and shortening of the penis when it's erect. This condition too can be treated with the P-shot and we can restore a significant degree of improvement with Peyronie's disease, which up till now has only ever been treated by surgery, resulting in quite significant deformity to the penis following this. This is an exciting area because many men suffer in silence with Peyronie's disease, and at last we have a treatment that is safe and effective for this condition. Although I mainly use the P-shot to treat medical conditions such as erectile dysfunction and Peyronie's disease, we do often see that there is an increase in growth of the penis, either length or width of the penis following this regenerative treatment. And some men come to see me specifically to try and achieve some degree of penile growth. Clearly this may have some benefits from a psychological and emotional perspective for these men. The P-shot procedure is a relatively simple and easy procedure to perform. Let me take you through exactly what happens. I take some blood from your arm, just as you would do having a simple blood test, and from that whole blood sample I can separate the cells out and extract through a cell separation system using the Magellan system the PRP, or platelet-rich plasma. It's these platelet cells that contain the growth factors that stimulate the tissue regeneration when they're re-injected back in. I usually apply local anaesthetic creams to the penis, and I can do a simple injection at the base of the penis to numb the penis, so that very little, if any, discomfort is felt when the PRP is injected back into the penis itself. Following treatment, there is some swelling of the penis, not surprisingly, because I've injected a volume of liquid into the penis itself. That will resolve very quickly, usually within the first 2 or 3 days. There's a small risk that there can be some bruising, but that's not usually troublesome for most people. Normal sexual activity can be resumed almost immediately following the P-shot treatment. One of the important factors when we're doing a P-shot treatment, especially for erectile dysfunction and for treatment of Peyronie's disease, is to use a vacuum device following treatment. This is a very important part of the treatment, because without that vacuum device we wouldn't see the results that we see. The vacuum device, which many men already use for erectile dysfunction, draws blood into the penis and engorges the penis. This is part of the stimulatory process. If you imagine if a bodybuilder tries to improve the size of a muscle, they need to do some exercise to increase the size of the muscle. This is a way of exercising the penis and to draw blood into the penis, which is going to improve. We normally suggest that men use the manual suction device at least twice a day for quite a few weeks following the treatment to achieve the best results. A lot of people ask me, how long do the effects last following the P-shot? And it really depends on what condition we're treating, and that dictates on how often you have the treatment. Certainly for erectile dysfunction or Peyronie's disease, we normally suggest that somebody will need between 2 and 3 treatments initially to get a full result. The timing between the treatments is usually between 3 and 4 months. Following this, there is usually a normal function is achieved, and another treatment may or may not be needed in the future, but perhaps 1 or 2 or 3 years later might be appropriate. If somebody's looking just to generally improve their erectile function, so maybe they're not suffering with severe erectile dysfunction, but they just would like a stronger, healthier erection, then just usually 1 treatment is needed, and that will suffice. It can be repeated at any time, as it is a safe treatment. There is no adverse, long-term adverse effects from having these treatments, because we're using your own cells to rejuvenate and regenerate your tissues naturally. If you'd like information about this treatment or any of the other treatments that I offer through Skin Excellence clinics around the southwest and south of England, then please contact me on this telephone number or take a look and get the details from my website.